Al from Cornell's Dairy Extension bringing you coronavirus booster for the week of January 25th. First, the numbers. Since January 12th, we have a steady decrease in the number of cases, which is very encouraging, but this is still just the beginning. We are currently at almost 170,000 daily cases, almost 120,000 hospitalizations, and more than 3,000 deaths every day, which is still high. The encouraging part is that what we are currently doing works, and this can bring the numbers even lower. What we have to do is continue doing more of the same, which is be vigilant with keeping that physical distance. We have to properly wear our face coverings, which, yes, it means you have to cover your nose as well. We have to keep washing our hands frequently as possible, and we have to avoid touching our face. If you have to touch your face, make sure you wash your hands before and after. Last part, avoid large public gatherings and any indoor public spaces. Next, the news of the week, COVID-19 in ice cream. This is not the first report of SARS-CoV-2 being found in frozen food. And there's always the same question. What did they find? Did they find actual live virus or just the genetic material? I would say that based on the report that imported milk powder tested positive, that they used and tested for genetic material. Because I cannot express how unlikely it is that a live virus made it across continents in something like milk powder. So the virus itself is highly unstable, and conditions in milk powder would make it even more unstable. Now, after the virus is inactivated, what's left behind is this genetic material, which can remain there a long time after the virus is inactivated. And here I have a question for you. So if you imagine when a forensic investigator finds DNA at the scene of the crime, does that mean that the criminal is still there? No, of course not. The criminal is long gone, and so is that virus in the milk powder and ice cream. But let's say that they did find live virus in ice cream. How did it get there? We already said that imported milk powder, very unlikely source. They didn't mention domestic ice cream ingredients, also probably very unlikely source. How about contamination during production from an infected employee? Now that would be a much more likely scenario. Last question, if they did find the virus in ice cream, should we worry about it? Should we stop eating ice cream? And the answer is, of course not. Even if there are some positive food samples, the number of these samples is very, very low. And also the number of viruses found in those positive samples is very, very low. Far too low to cause an infection through ingestion. What you need for infection is sufficient number of live viruses reaching those right receptors in your nose, mouth, and eyes. And this is not something that's very likely to happen when you're eating ice cream. Now, let me tell you about a scenario that is more likely to happen, and that is you getting infected from a person eating or shopping ice cream next to you. According to Jeffrey Shaman, there's currently 3.6 million infected Americans that can pass infections to others. This would be about 1% of US population. Now, if we compare this number to the number of positive frozen products, so according to South Chinese Morning Post, Chinese customs found 13 positive frozen food samples of almost 900,000 that they tested. So this would be 0.002% of frozen food samples. Now, let's say this represents the frozen food on US market. It doesn't, the percentage is most likely much, much lower, but let's say this is it. This would mean that you would have to taste 500 individually contaminated frozen food products in order to reach the same risk of exposure to the virus as having close contact with a single person in your grocery store. So stop worrying about your ice cream and start worrying about people around you, because they represent the main risk of infection. So keep that distance, wear that face covering, stop touching your face, wash your hands, and avoid public places and public gatherings. Thank you very much. So this coronavirus booster series is part of the program supported by USDA NIFA and brought to you by Cornell's College of Agriculture and Life Sciences Dairy Foods Extension and by Cornell's Institute for Food Safety.